Let us listen to Dr. Homer Lim of the Concerned Citizens, Doctors and Citizens of the Philippines. By the way, this is not a small group. This is a big group of top 5,000 experts and business leaders. Dr. Homer, take it away.
Good afternoon, everyone. Thank you. We are honored to be invited into this special talk today on vaccines. Just to make a point, I'm not the chairperson. I'm the co-founder, but the chair or the president of the CDCPH is actually Dr. Iggy Agbayani. So just before I move forward, I just to make a clarification as well as disclaimer that I have not that we have not me personally have not received any form of financial assistance in cash or kind with regards to everything that I will be talking about. All the drugs and vitamins and minerals that I will be discussing, I have no financial gains with this. Okay, so to this talk, because I only have 15 minutes, so I'm going to be talking a bit fast. So I hope you just follow as quickly as I can talk. Okay, so are we really ready to be vaccinated? Okay, so global rates are declining. If you're going to see worldwide, the cases are now actually declining. Now, are they due to vaccines, or maybe there are other factors that we have not really looked into that's causing a decrease or a decline in vaccines? Okay. So if you're vaccinated, will you be immune to the COVID virus? This is one of the most important things that I always tell to everyone who keeps on asking me whether or not are you going to do the vaccine, are you going to take the vaccine? So I think more important is when they say the vaccine is efficacious or effective, what do they mean by that? What do these studies show? Will it really protect you from the virus? The answer is no. Even Dr. Fauci said, early COVID-19 vaccines will not, okay, block the virus. Okay, it will prevent you from getting symptoms, or it will prevent you from getting a severe form of infection, but it will not prevent you from getting infected. Therefore, if you do get the vaccine, does not mean that you will not be infected. It only means that it might help you not have a severe form of COVID infection. So a lot of questions now arise. So can the COVID vaccine stop the spread of the virus? The truth answer is no one knows. Why? Because this vaccine is quite new. There's, practically less than a year with regards to from development to its release. It's only less than a year. So therefore, vaccines will not prevent or lower the number of cases, but only avoid severe form of illness. So I think that is what we have to become aware, that these vaccines does not prevent you or block you from getting the virus, unlike other viruses. Please don't get us wrong. I'm not an anti-vaccine. Actually, I think one of the greatest invention of humankind actually is the vaccine. We have eradicated polio. We have almost eradicated. Smallpox. We have almost eradicated polio. We have eradicated a lot of those childhood disease precisely because of the vaccine. So these vaccines work. However, for this COVID vaccine, honestly, we don't have enough data. So why do we then vaccinate if we know that it will not block you or prevent you from getting the virus? Who are we supposed to protect, right? So if this is based on our data, local DOH data, even global data, the same thing, 95% will have mild or asymptomatic disease, meaning 95 out of 100 people will only have mild symptoms or asymptomatic. However, which is what we are more concerned about, are the 5%ers. The 5%, we call them the vulnerable because they will develop what we call a moderate form to a severe form of infection that would require hospitalization and are more likely to die from the COVID. So this is what we concentrate on. So when we think about who are we supposed to vaccinate first, Are we supposed to vaccinate first the 95% who have mild or asymptomatic, or should we first look at those who are more likely to develop severe symptoms, right? Or severe forms of COVID? I think that's important. So how do we measure vaccine? I think this is one of the things that we have to be aware of. How do we measure vaccine efficacy and safety? Efficacy of vaccine when it prevents the disease or prevents from being infected, it reduces illness severity and preventing death. So this COVID vaccine, when it was released up till now, what has it shown? It did not show yet to prevent disease or infection. However, it does seem to reduce illness. Preventing deaths, we still don't have data. We don't know, right? Safety. So when it comes to safety, one of the biggest issues why a lot of people are afraid of vaccine, I think one of the reasons for this was really the trauma that Filipinos developed because of what happened to them back there, which is quite sad. So I guess that's one of the reasons why there's a bit number of people who are quite against the vaccine. So when we say safety, we are talking about immediate adverse reaction, meaning after injection, do you develop any forms of adverse effects within 6 months, 6 hours, 12 hours, 24 hours? When we say midterm to long-term adverse events, do you develop other symptoms or diseases 2 years at 5-year interval from the time of injection, which this being done, we actually do monitoring, or in the United States, they do monitor kids at 2 years and 5 years checking for adverse events. And of course, lastly, efficacy. They are looking at lifespan and mortality. Does it improve the mortality rates? Does it improve the lifespan of those who are vaccinated versus those who are not? So that's vaccine safety. So right now, can we really say it's safe? We don't have enough data yet. I think that's what's one of the things that we really have to impart. It doesn't mean it's not safe. It's just that we don't have enough data yet. So do we really wait for vaccines? I think one of the biggest issues now is procurement of vaccines. Sadly, we won't be having a hard time really procuring vaccines until we get our indemnity bill in place. Because without that, these drug companies will not actually allow us to buy. I guess only except Sinovac, which has already started releasing. So instead of being doom and gloom, we as a group are more advocating focused protocols, meaning we focus on areas where we can improve our lifespan, we can improve our COVID infection, because we want to make sure that even if you get COVID, it doesn't necessarily mean you're gonna die. Okay, I think that's one of the things that's most apparent in a lot of people. When they know that they have COVID, it's as if they're gonna die the very next day. I think this is one of the things that we advocate. So our advocacy is we prevent you from being hospitalized. Okay, and of course, if you're not hospitalized, then you're not gonna die. So that is one of the things. So we advocate what we call an early treatment protocol. We treat you as early as possible, as to avoid hospitalization, of course, to avoid death. And therefore, if you are able to avoid hospitalization and death, then we can ease the lockdown and do what we call focused isolation and protection. So our goal is to save lives, reduce cases, and of course, everybody, I think, whether you're for vaccines, against vaccine, the most important thing is we save our countrymen, we save lives. Okay, now this is our current approach for COVID. We apply barriers, face mask, face shield, all the different barriers, travel restrictions, you name it, we have it. Okay, however, if you get COVID, what would doctors usually recommend? If you get COVID, you just take your vitamins, some antibiotics, and just wait. If you get too sick, then you go to the hospital, right? So then you overload the hospital. If you are a vulnerable patient and you know you're more likely gonna get sick to the point of being hospitalized, then of course you're gonna go to the hospital. So this current approach, there seems to be a lacking a lacking part in this. How do we avoid patients who are infected to be hospitalized, right? How come nobody is thinking of this solution? There is actually, okay? So this is our proposal. Once you get infected or once you have symptoms of what we call COVID-like symptoms, cough, colds, difficulty breathing, fever, body pains, don't even wait for the test results to come out. Treat early, meaning you treat within 2 to 5 days of your symptoms, you treat it as soon as you can. And of course, one of the things we also advocate is prophylaxis for those vulnerables and frontliners. Who are the vulnerables? The four vulnerables are your 50 and above, those who are obese, diabetic, heart disease, lung disease, kidney disease. So all those with chronic degenerative, chronic illnesses, you are therefore more prone to getting a severe or moderate form of COVID. Frontliners, we give prophylaxis to frontliners because we don't want them to get sick, right? So those are your, not only your nurses and doctors, this includes your policemen, those in the utilities, those in the transportation. We have to give them prophylaxis so that they do not cause infection and they could not cause spread, right? So instead of making barriers, why don't we make our immune system stronger? It's just like your vaccine. The vaccine is giving you a certain genetic instruction or an attenuated or part of a slightly dead virus. We call it attenuated. It's a slightly dead virus or a weaker virus so that your body produces antibodies against the virus. But there are also other ways to improve your immune system, right? So focus groups. So this is our way of trying to make our immune system strong, protecting everyone, okay? Boost the immune system every time. Prophylaxis, again, for frontliners and for those who are vulnerable and the elderly. And if you have symptoms, you do not wait to be in the hospital. You treat it early as possible. So for boosting system, I think you are very, very much aware of this, except for, I guess, some quercetin. They've been shown to quercetin to prevent the transmission or infection of the COVID virus, especially, again, also same with the green tea extract, which is a EGCG, which is epigalic, it's a very long name, galacto, uh, I call it easy because it's so hard to pronounce anyway. Okay, so even Fauci himself said, if you're vitamin D deficient, that does have an impact on your susceptibility to infection. I would not mind recommending, and I do it myself. So Fauci himself admitted that he takes vitamin D supplements, and the other vitamin that he takes is vitamin C. So if Fauci is taking it, why shouldn't we all, right? So early treatment protocols as early as third quarter of 2020, a group of doctors with primary author Dr. Peter McCullough already proposed an early treatment protocol. So protocol is where we base our early treatment protocols. So one of this is actually hydroxychloroquine, and there is so much controversy, so much bad mouthing about hydroxychloroquine, so much debate, but the truth of it is hydroxychloroquine, you could see 197 trials, over 167,000 patients treated, 67% improvement in early treatment protocols or trials, and in prophylaxis, 36% improvement. Early in this COVID pandemic, I personally been treating patients. I was using hydroxychloroquine. However, the dose of hydroxychloroquine that I was using was way, way lower than what the World Health Organization as well as the Solidarity trial. And then towards the end of the year, we found this wonderful drug. So many studies coming out from South America, from Europe on this wonderful ivermectin drug. This is an anti-parasitic drug. Incidentally, ivermectin, the discoverers of the ivermectin molecule, Drs. Campbell and Amuro, actually won the Nobel Prize for Medicine because of ivermectin, and it is used as an anti-parasitic drug. And what's nice about this is, if you would look, 90% improvement in prophylaxis. If you take prophylaxis, meaning they take it for prevention, 90% improvement. If you do early treatment, 84% improvement. That's even way, way better than hydroxychloroquine. And what's more important is you only take ivermectin at 1 capsule a day. If you get COVID, that's how wonderful. And you could see here early treatment protocols on ivermectin. Early treatment, 85%. As prophylaxis, meaning you prevent people from getting infected, 90%. So to the point that Dr. Paul Marik, also one of the advocates of using ivermectin, heparin, dexamethasone, or prednisone, he himself said, this is a gift to us. Ivermectin is effective for prophylaxis and treatment. When I read this, the first impression was he was overhyping it until I myself, because I myself, I've treated over 500 patients with COVID. None of them gone to the hospital. I've treated patients from 6, 7 years old up to 90, 95 years old. None of them went to the hospital because we did early treatment protocols. If you would see, even in Belize, use ivermectin. In Iran, they're using that. In India, in Goa, as prophylaxis, and even in Macedonia. So ivermectin is already widely popular in was this it's widely very popular in Europe and in South America. Okay, so here hydroxychloroquine prophylaxis, you could see in India 89% infection. However, this trial, I mean, in terms of efficacy, was not repeated. However, if you would see the dose, this is quite different from the dose in the WHO trial. Okay, as early as May of 2020, India already advised hydroxychloroquine prophylaxis for the healthcare workers. Ivermectin prophylaxis, a much cheaper, much safer drug at only 2 doses, 72 hours apart, and you're good for a month. That's how good it is, okay? So prophylaxis treatment, we always recommend vitamin C, vitamin D, zinc, quercetin, virgin coconut oil. And if you're a frontliner or a healthcare worker, or you're exposed to a lot of people, you or to those who have COVID, then you might opt for a hydroxychloroquine or ivermectin. So again, this is just the drug dosages for early treatment protocols. So people keep talking about safety. Hydroxychloroquine dose at 400 milligrams, which is what we give to our patients.
Oo
Okay?
naman, don't worry.
At 400 milligrams a day, and as early as July, you could see here,
Kasi
July
maaarte yung
2020,
customer namin.
it is
Gusto
very
nila
safe.
pagpasok nila.
It is very safe.
Can we
It's
please
very
ask
safe.
everybody to mute yourselves? We can hear your private conversations. Thank you.
So hydroxychloroquine dose at 400 milligrams a day is very, very safe. No signs of heart problems, okay? And ivermectin, how safe is ivermectin? They even give ivermectin to babies who develop scabies. So ivermectin is, I think, one of the things that we really have to look out onto as a treatment. So this is the cost for prophylaxis. If you're going to take hydroxychloroquine, the monthly expense would be around 935. However, if you take ivermectin at 35 pesos, either you spend 70 pesos, or if you're quite afraid, you want to take it 1 tablet a week, 140 pesos. So what we're trying to show you here is there are other options while waiting for vaccines, as what we have presented, and as also what Senator Soto has already espoused during his talk yesterday, the other day at the Senate, that we need to do early treatment protocols. Because we cannot wait for the vaccines. Because honestly, the allocation for the vaccine are